We get exposed to these contaminants and we bioaccumulate them because we don't detoxify them well. Hence, we focus on detoxification. When they bioaccumulate in the body, they like to be stored in the fat. So they get pushed into the fat tissue after circulation because the body is called thermal equilibrium. And so when you absorb those pollutants, whether you breathe them, eat them, put them on your skin, they go into blood circulation. Liver tries to detoxify them. Oftentimes the liver can't break them down into less toxic compounds. So they circulate in the blood. Well, they're not supposed to be in the blood. It throws off the chemistry of the blood. So the body's very intelligent. The body says, I need to take you out of the bloodstream because you're throwing off how I save this body and help it work. I'm going to push you and store you into the fat cells. The brain, the fat. And now you are poisoned. Oh. And that's why it's so important to detoxify, because those poisons stay in the fat cells. They mutate those cells. They mutate the genes in the cells. Cancer. They damage those cells, the mitochondria. Cancer. Now, those are just the things that we talk about, but really they damage the cells so much that they become less capable, less efficient, and they open up the disease process and allow it to happen in your body.
That's frightening.
It's frightening, and it's a biochemistry reality. It's not a discussion, well, I don't know if I believe that, doctor. It's not a belief situation. It's science. It's how the body gets sick. Unfortunately, what I see a lot in my office is out of sight, out of mind.
Right.
Yeah, I breathed it in. I didn't notice anything. No big deal. I ate it. I didn't notice anything, Dr. O. No big deal. Bioaccumulation is a reality from a biochemistry, from a biological standpoint, from a standpoint of how does the body balance out the physics every day to maintain good health. It's called homeostasis. When we start getting out of that homeostasis from the things that we're talking about, a headache, fatigue, a mood disorder, a skin rash, a digestive issue, as those maintain themselves in the body because you didn't go after the underlying reasons why they're there, then they start turning into osteoporosis, dementia, the mood disorder turns into schizophrenia or bipolar or severe depression. The blood sugar starts to change, the lipids start to change. There's always a history with every health condition. Here we have the capability, since we're integrative, we do have the capability to medicate those symptoms, but that's not our philosophy. Our philosophy is if you're feeling terrible with that migraine, yeah, we'll go ahead and give you some medication because we don't want you to suffer. But in the background, we're going to create a plan of care to address what in the world would ever be so catastrophically wrong that you'd express inflammation in your brain that we call a migraine. We take that to every level with every condition. I don't care if it's a migraine, I don't care if it's lupus or multiple sclerosis or diabetes, it just doesn't matter. There's always a history behind it, for sure. And that's what we address every single time.